Welcome back to Pulamet. Today we will be discussing aspects of drowning. There are so many terminologies that are obsolete right now with respect to drowning. So let's not discuss those confusing terminology and let's proceed. Respiratory impairment from submersion in liquid is what we call drowning. It is the third most leading cause for accidental injury death. Risk factors include teens and toddlers. You can see here in the image what I have mentioned. Toddler falling into bucket of water. Yes, that is right. Mostly it is artificial sources that is the cause for drowning, like bucket of water, bathtub, as well as swimming pool, rather than natural water body source like oceans, lakes, and rivers. Males tend to have more risk of drowning because of their increased risk-taking behavior as well as their alcohol consumption. Even drug abuse that could result in impairment of judgment during the water activities could result in drowning. There can be arrhythmias and seizure disorder that could cause drowning. Sports like diving and falls could result in drowning. Coming to pathophysiology, submersion is the first thing that happens. That is, airway is going to go below the level of water surface. And when this happens, there will be signs of struggle as well as breath holding. Signs of struggle include trying to grasp things which are present nearby, like grass or mud. This is very important with respect to medical legal aspect because signs of struggle indicate the person is alive during the process of drowning. If there are no signs of struggle, it could be that the person is dead and is thrown into water. During the breath holding, hypercapnia will take over and it will cause gasping, which results in aspiration of the contents, resulting in respiratory failure and hypoxemia, which eventually causes cardiopulmonary arrest. Once the person is drowned and is brought to the shore, assess the symptoms. In case he is completely asymptomatic, offer him dry clothes and blankets, ask him to remove his wet clothes, as well as we try to observe him for at least 4 hours. In case this is mildly symptomatic, like only cough is present, then also it's the same thing, but the only duration is we're going to observe him for at least 8 hours. In case he's having distressing symptoms like tachypnea, dyspnea, syncope, foam at mouth and nose, rails during auscultation, shift him to the hospital and evaluate there. What if the person is in cardiopulmonary arrest? Then the next thing we do is airway assessment. We're going to remove any foreign particles that are obstructing the airway, and then we are going to give mouth to mouth ventilation or mouth to nose ventilation. Cardiopulmonary resuscitation should be started immediately and can be continued up to a max of 30 minutes. In case the person is submerged for more than 1 hour, it is really debatable if cardiopulmonary resuscitation is going to revive the patient or not. During the transport, provide supplemental oxygen, cover the person with dry blankets, remove the wet cloth, protect from wind and weather. In the emergency department, assess for airway, breathing and circulation, mental status examination, oxygen as well as intubation if necessary. Gastric decompression is done if there is suspicion of large volume swallowing during the act of drowning. Aerosolized albuterol and ipratropium for bronchospasm, mannitol for cerebral edema, hydration and inotropes for hypotension. We maintain the temperature of the person at 90 to 93 degrees Fahrenheit. This is to ensure mild hypothermia, which protects the brain from hypoxemia. Arterial blood gas analysis reveals hypoxemia. STXA PAView reveals bilateral diffuse patchy opacities. We also do RFT electrolytes, CUE, GRBS, ECG, and aspirate gram chain and culture sensitivity. With respect to prevention, supervision of the child is very important, either by parent or lifeguard. Child can be enrolled in swimming courses. Fencing of the pool should be done. Alcohol and drugs should not be used by adults. In case the person finds himself in a submerging vehicle, he should come out of the vehicle in the floating phase only. Use personal flotation devices. Always try to ensure the safety of rescuers because most of the times what can happen is the child starts drowning, parent tries to save the child, parent ends up dying, child will survive. Avoid prolongation of breath holding time. Rescue technique includes reach, throw, row, and go. In reach, what the person is going to do is going to use a branch or a rope or paddle or oar or any other object to reach the victim who is drowning by being on the shore or in the boat without going into water body. Second is throw. Whoever is rescuing, he will throw an object that is floatable. Like it could be a personal flotation device. Next thing is the person will try to go for rowing. Rowing is where the person will use the boat or watercraft that is capable of holding both the rescuer and the drowning victim. he can row towards the victim and try to help. Then last resort is go. This is only for professional rescuers who can go and try to rescue. In case you are being carried away by rip current, swim parallel to the shore and never against the current. In case you fell from boat, make sure you do not carry anything heavy because that is going to submerge you, and also hold on to that personal flotation device. Try to float on your back, and in case there are no rescuers and it is time for the rescuers to come, then use the huddle technique if you are in a group, or use the help technique, heat escape listening posture. Thank you very much for listening. Don't forget to subscribe, like, share, and comment.